everyone. Today we have a very special guest, and Dr. Akinyemi will be joining us today. She's one of our medical officers at Pediatric Partners, and she's going to be giving us information about anxiety. Thank you for being here, Dr. Akinyemi and Dr. Tomi. Dr. Akinyemi, take it away. Thank you.
All right, thank you, Ma. Hello, everyone. My name is Dr. Akinyemi Temlolua. I'm a medical officer in Pediatric Partners, and I'll be talking about anxiety in children today. Now, I'm happy that with the trends we are having now, it would not seem like a strange topic to talk about, because now there's awareness about mental health, and there's awareness about the fact that not just adults go through this, but also children. Anxiety is one of the most common childhood mental disorders or mental illness that a child would have. Is very, very common among children, and symptoms would often go unnoticed because the symptoms can be, how would I say this? They're not familiar symptoms, they are other things. So we have symptoms like a child is always complaining of tummy ache, Mom, my tummy is aching me, she has gone to the hospital, there's no fever, there is no pain on urination, we're not suspecting urinary tract infection, but the child is always complaining of that, or the child is always complaining of headache. Other things, even nausea, feels like vomiting, or is throwing up. Now, these are symptoms that a child might come down with, and we are looking at every other thing, but thinking about, could there be something else? Now, other symptoms that might point more to the fact that it could be anxiety is that you notice probably this child was once very lively, very active. The child doesn't like doing these things anymore, or concentration in class is quite poor. So a child's teacher might call you that you notice, okay, your child is no longer paying attention in class, is now doing poorly in school, or the child doesn't like to go to school. When it's time to go to school, I know children are usually excited, they want to go meet their friends, but then this child is no longer, he doesn't want to go again, or the child is having concerns about things that should not be expected. Now, anxiety is just excessive, persistent fear and worries over common things. Now, the issue about anxiety disorder is that it usually starts to impair daily activities, or the normal life activities of this person. Anxiety is quite common. It's a normal thing. Every single day, everybody worries about a particular thing. We fear about a particular thing, but it becomes a problem, it becomes a disorder when it starts to impair this child's physical activity, the child's cognitive activity, mental activity. The child is not able to function properly again. And I think one beautiful thing about this is that the moment you're able to really catch this early, the best that would work, and more often than not, is something Dr. Tomi mentioned earlier, talk therapy. We call it cognitive therapy. It's what would really help more often than not. So we try to address the fears, try to know what is happening with this child, like what's the problem, what are you scared of, what is causing an issue, and help them to face it. Talk about coping abilities, letting them understand that, okay, it's not a big deal. And patience, I think I would say patience is something that you really have to have in dealing with these children, because a couple of the symptoms they have are beyond their age. So you see maybe a 5-year-old, 6-year-old is throwing tantrums or gets angry easily. This child is normally calm, but just really gets angry easily. A parent might get frustrated and is like just shouting on the child, what is wrong with you? What is wrong with you? But the child is dealing with things, and that makes it worse. And that's why I said, patience is quite important for this child. We have to really get to the root of the problem, find out what is happening, and talk them through it. I mean, obviously, we have professionals that would help with that, which is very, very important, that when you notice this, it's important to actually go to the hospital, go meet your doctors, talk to them about it, and they'll help you about it. And another thing is that in terms of treatment, it's not just between the child and the doctor, it's a family thing. Family therapy is very, very important. Everybody in the family is involved in the treatment of this particular child. And with successful treatment, of anxiety, there's a big chance that this child will grow up to be a very, very mentally healthy human being. Growing up in the world, I won't say Nigeria, but in the world today, there's a lot of things that can cause mental breakdown.
And
Now,
that
if a
was
child, yeah,
more pronounced because of the pandemic. When
yes,
people had to be at home
very,
and all
very
kinds of
true.
issues came up.
Yeah,
Yeah, and people started
exactly.
talking about mental health
Yeah,
and wellness and all kinds of things came
yeah.
out. Yeah.
And you see, when the family gets involved, it just helps. It helps. A child is able to open up. Another reason why it might even go undiagnosed is because the child doesn't want to talk about it. Like, maybe a much grown up child. Why am I okay? Wait, maybe why am I scared of this? Maybe a child that is just unusually scared of the dark. It's not a big deal. It's not more maybe a 3-year-old that is scared of the boogeyman. He knows there's nothing like a boogeyman, but he's just really scared. He might feel, why should I talk about it? It's weird. No, I don't want to. But you see, when the family creates an environment that it's open, it's inviting, it to be easy. And the first step to getting better is really talking about it. Talking about it. And I'm happy that I said it at the beginning. I'm happy that mental health is something that it's now being talked about. A lot of people are talking about it. A lot of people are getting aware of it, and it's something we should really watch out for in our children and help them. It's not a problem. It's not your fault. You get? It's not the child's fault. There's nothing you did. It's just an illness that with proper treatment your child can get better and grow up to be a very wonderful person. So this is what I like to talk about anxiety.
All right, thank you. Let me ask Dr. Toby if she has anything to add to that.
Yeah, so just as Dr. Akemi said, anxiety can present with some unspecific symptoms. It might just be anything. And you see these kids, they come, maybe let's say they are supposed to go have a presentation in school, and maybe this child has stage fright, and he doesn't know how to tell them that, oh, I'm afraid, and everybody, you can't do it, your friends are doing it, why can't you do it? So instead of that, just try and, okay, do you mind if somebody else comes and maybe holds your hand together? Just try and understand where this child is coming from. Because I remember when I was younger, I was very insecure about my voice. I have kind of a deep voice. Okay. Everybody has sing-song voice, but when I talk, so yes, I didn't want to talk. I didn't want to talk. So when it's your turn to sing. So, but I had wonderful classmates. I was in boarding house. So once it's my turn, maybe one or two persons will also holds the mic with me.
Oh, that's so nice.
So beautiful.
So they recognize that
Yeah.
when they could do it as a team with you, it helped.
Exactly.
Those are good friends, but they had even more knowledge than they realized at that time.
Yes.
Because we didn't even know what was going on at that point in time. But if I do this, you told me she'll be able to get up there and do it.
And do it well.
Exactly. And we didn't even know what, as I said, we didn't know what was going on at that point in time. But after a while, of course, I got over it and I could stand on the stage. I could stand on the stage. So yeah, you don't have to shout at the child. You don't have to berate the child. Just try and encourage the child. It is not, as I said, it's not something you've done. It's not your fault. It's just like a child has stomach pain.
Yeah.
But instead of a physical illness, this is mental.
And then they call it abdominal migraine.
Or functional abdominal.
Right. Okay, so we had actually thought about you talking about the different types of anxiety, but now because of time, we're going to just shorten it. So what are the 3 commonest anxieties or disorders that?
All right. So in children, we have the general anxiety disorder. So this child is just scared of everything. It's not specific, and it's quite unusual for a child their age. So just general, it can be anything. It can be they're scared to go to the toilet alone. It can be they're scared to sleep in their room alone. It can be they're scared to go to school or to go down a slide. You get just unusual, so general. Another thing that is quite common in children is something we call separation anxiety. Now, separation anxiety is a usual thing that occurs between the age of 8 and 12 months in a child. So this child is normally weary of strangers. They'll rather be with their mother or their father, people they know, than someone they don't know. But we expect that child outgrows this anxiety by the time they're going to preschool. So by this time, they're going to meet new people, they're excited, they want to. But the moment you notice a child that is, is really scared of strangers, a child way past toddler stage, doesn't want to leave his parent, doesn't want to sleep alone in the room. I'm talking about maybe a 10-year-old child, a 12-year-old child, doesn't like it at all. There's a big chance that is separation anxiety.
And what's the third commonest?
Yes, and the third commonest, we have the social anxiety. You mentioned that a child that is scared to speak in public, scared to make friends, and not just shy,
It's
scared.
actually more common than a lot of people realize.
Yes, very,
you invite
very
somebody to a
common.
party, they never show up, or they tell you I'll be there, and then they don't come.
Yeah.
And then it's time to talk, and everybody's mouth is dry, and they're like, oh, looking around, and people start clapping for them, and then they get a bit encouraged. So anyway, because of time, we'll be rounding up on this talk. But thank you, Dr.
Thank you,
Akinyemi. Dr. Akinyemi is going to be going in for a residency in psychiatry, and that's why she's our guru when it comes to anxiety. So thank you for that. Dr. Tomi, anything else to add? 2 seconds.
Okay, so graded exposure helps with separation anxiety. So you don't just leave the child.
Yeah.
You leave for 10 minutes, come back. Leave for 20 minutes, tomorrow 30 minutes. So that's it.
Okay, wonderful.
All right, so thank you very much, and thank you. Please subscribe to our channel if you haven't already, and we'll see you next time. Thank you, and bye-bye.